Good morning, Sarah with the Department of Medicaid. It's not quite 11 o'clock and we're still clearing out the waiting room, so we'll give it just a moment before we get started.
Thank you.
The waiting room is cleared if you would like to begin.
Thank you. Good morning, everybody. We'll get started with the TAC committee introductions. I'm Anlin Purden with Hazelwood Home Health.
Good morning. I am Janet Marlene Reynolds from LHC Group.
Good morning. I'm Evan Reinhardt from the Kentucky Home Care Association.
Is that all of us today? Teotis or Susan?
So far, that's all we have. I'll let you know if they join.
Okay. So do we have a quorum with 3?
Yes, ma'am.
Okay. All right, then. We will do the approval of the June the 11th, 2024 minutes. I'll make the motion to approve.
I'll second.
I believe that's everybody then. So those are approved. Old business. Do you want to go over that, Evan? And I think all the new business is mine, so I'll do those.
Yep. Sure. Just checking back in on an EVV update. I think we're expecting some further information at some point here pretty soon. Aaron, do you know if there's anybody from CMS that can speak to that?
I was scrolling through and I couldn't manage to get myself off mute. I am.
I was looking to see if April or Laura were on here. Maybe we can come back to that one and I can ping her to see if she is available. I know that there was some information regarding EVV that was sent out about the timeline. What was your specific question?
That's really just what we're curious about, and I didn't. I may have missed that, but we're just waiting for timeline for going to the full implementation.
Okay, I think that there was, like I said, something sent out on the timeline. So let me look, and that may have been, and I'm sorry, I'm not the primary point person on this, but that might have been for the PCS transitioning over. So, Aaron,
Yeah, I saw that one. There's
okay.
information just about the full switch to Therap, but I don't think we've seen anything about going to the hard edits for home health.
Okay. All right.
We have
Oh,
the hard edits go live 1/1 of 2025.
Okay.
That was released out by Jade.
Good to know. Perfect. Thank you.
Do you have any other questions, Evan, that I can follow up with April on?
I think that's it for the moment.
Okay.
If we come up with anything internally, we'll definitely follow up with you all.
Okay.
Evan,
Thank
do you know, is their app still having meetings for home health, or are they all PDS now?
I don't know that one off the top of my head.
Okay.
I thought they
I
were
can
doing it maybe for both, but
I
I
can
could be.
email Fair App, because now
Yeah,
that I'm really, I thought we were doing great, and then when I started matching up our visits, I found all the mistakes we're making. So I just need to get with them. Thank
gotcha.
you.
Yep. All right. And then second item is an update on the supply fee schedule. I think we're still waiting for information on that. And, I know Anlin and others are, kind of waiting for that update to figure out how things are going to work going forward.
And then it is April, and I think I have updates for the fee schedule. And I apologize for running behind. My prior meeting ran over.
No, no problem. So do you all know when that'll be published or?
Yes, so um, I think we have completed the comparison, but I also had a question for the group.
Okay.
If you will bear with me just 1 minute, let me pull that up. So, can we also recap EVB? I know that there was some questions, I believe, on EVB. So, the hard editing for HHCS, so that is for every visit, there has to be a claim, um, and that editing will be turned on as of January 1 of 2025. So, again, for every visit, you have to have a claim, and those two must mirror to be able to be paid after 1/1/25. If and there is communication in process and will be sent out soon on that. I know that memo is going through final stages. Is there any Was there any questions around that? That will not affect the personal care services that are transitioning over on October the 24th. That is strictly the hard edit for claims is for the HHCS that went live January of 2024.
Understood. Thank you. I think that's all the questions we had.
So on the schedules, I know that comparison's been complete. We are waiting next steps, review from the commissioner's office to publish that, but also would the home health TAC be interested in us reviewing what other states' fee schedules look like?
Anlin, what are your thoughts on that? Should we take a look at what other states are doing?
Yeah, couldn't hurt.
Yeah, I'd agree. I don't know if others have additional feedback, but I think it's worth taking a look around and giving us a comparison, especially with the amount of folks that are coming back and forth, to Ohio and elsewhere surrounding states. It'd be good to just see what they're doing too.
Okay. All right. So we can provide, again, some additional feedback for that next time, if you all are interested in LTSS doing a little bit of a review of deeper dive of surrounding states.
Sounds great.
Okay. And then is that all of LTSS updates? Looks like there is information about total number of slots, funded active waiting list numbers. Is that correct? Is that what
I
was up
think that was a
next?
question that someone passed along last time for the waiver specifically, just, understanding what number of slots we have, that are active and then what the wait list looks like.
Okay. If you can hold on just a second, let me see if I have that readily available.
Okay. Yeah, we'll come back to that one. Do you want us to
Yes,
go ahead
please.
and jump down to new business?
Thank you so much.
Sure. All right, Amlin, I will turn it over to you.
Okay, thank you. And I'm sorry, the air kicked on in my room and it's like a wind tunnel, so I hope you can hear me. The first one, I did get the email about ESET that they're hoping to have some future updates that'll allow for modifications, and then we just have to fax them in. So I think that one is resolved. The condition code 12, I've discovered it's suddenly becoming an issue again. Aetna, or I'm sorry, not Aetna, Anthem, like we key in claims through Availity, and then Availity won't allow the 12 as a condition code. And when I talk to Availity, they tell me to call Anthem. When I talk to Anthem, they tell me to talk to Availity. So just wanted them to know that's an issue. I forgot how I finally worked my way around it, but I did finally. Oh, I know. I mailed the claim in. So that's how I got around that.
This is Kathleen with Anthem. I'm sorry to interrupt. I just wanted to know if are you working with a do you have any contact with Anthem representative? Because I can.
Yes.
Okay.
Teresa is mine, and she was the one that told me to go to Availity, and then Availity said that no, I needed to talk to Anthem, and it was just a back and forth.
Okay.
So I just mailed the claim in to make my life easier.
Yeah, okay. And Teresa's last name that you're reaching out to?
That'd be really nice, isn't it?
Okay. As long as you've got a contact name, that's great. And
I'm not going to say it right. It's Aussem Lopez, a hyphenated last name.
Okay. I'm not familiar with her, but if you've got a contact and you're resubmitted the claim, is that?
Yes, I mailed it in. I don't know that I didn't get anywhere with it electronically. Like everybody told me to talk to everybody else. So I thought I'd bring it here so that maybe you can take it back.
Okay. I would need more detail. The member ID, the data service, the code. If you want me to follow up, and I'll reach out to the.
Yes, if you could put your email in the chat, I will email it to you.
All right, I sure will. Thank you.
And Anna, this is Erin. I just wanted to let you know we do have a couple representatives on from Gainwell today that wanted to, if okay, do a presentation over your, I believe, item number 1 under new business.
Sure.
Is that okay? Okay. Miss Taylor, if you're ready, you should be able to screen, or Tyler, excuse me. I didn't mean to call you Taylor, I meant Tyler. And you can go over.
Hi, this is Catherine Simpson. Should we just grab the share? I'm with Gainwell. Is that how you want us to do it? Just grab the share and do our slide presentation?
Yes, Catherine, are you the one screen sharing?
I'm going to share the screen, and then Jeannie is going to do the talking. We just kind of split it up just to make it, how it is sharing slides and talking at the same time. So I will share and be quiet, and Jeannie will go through these slides. Let me start my slide presentation mode, and then I'll share my screen. Let's see, I don't usually share on Zoom, so let me get the right screen. Tell me if you see something that looks like a slideshow, but it's just not in the slideshow presentation mode yet. And let me do that. And Jeannie, can we hear you?
Yes.
Okay.
Good morning. Yes, I am here.
Okay, I'm going to hit this slideshow from the beginning. Okay.
Okay. Good morning, everyone. My name is Jeannie, and I'm one of the assistant managers at Gainwell Technologies. And in today's presentation includes an overview on how authorizations work in a set. Next slide. Authorizations can be submitted by fax, phone, or portal. And the documentation needed upon request is the MAP 130, the MAP 34, the CMS 485 Plan of Care, MAP 248, and any clinical notes if additional information is needed. This is a Visio, a high-level flow of the ASET process. And it begins when a provider submits a prior auth request, either by fax or by phone, for a new service or modification of a request. The provider also has the opportunity to use the portal to submit the request for new authorizations that can include multiple codes if the service end date is within the plan of care date range. The Kentucky Utilization Management Team will review the requests for medical necessity. Next. And at the bottom, you will notice that there is a learning system and a website that you can utilize for any training. And the provider portal standard operating procedure is in the LMS, the learning system, which provides a step-by-step guide on utilizing the provider portal. Additional education is available on the LMS site to provide targeted education. The tips for request are, if a provider is using the portal, please attach the clinicals to the request. And if you are faxing, please include the associated PA number on a cover sheet and indicate what is being requested. For example, I need to add 2 skilled nurse visits to PA number, and you put the number. A PA for initial assessment visit only is not required. The assessment visit is to be added to the request if the member is accepted for services. The assessment, PT, OT, ST, social work, home health aid, and supplies can be all on one PA. The plan of care must be included for skilled services. The plan of care is valid for 60 days for skilled services, 90 days for supplies. A new PA is needed every 60 to 90 days to align with the plan of care. Common reasons for lack of information letters is a request is entered into the portal without clinical information, and necessary documents were not received, such as a MAP form or the plan of care. Why do some services have overlapping dates while others are rejected with the same scenario? We get duplicate requests and it will throw a duplicate error. When a PA is submitted and there is an active, current, prior auth for the same services and date range, this results in a cancellation of that second request and a modification made to the existing current active PA. Modifications of the request, we're requesting if you can submit through the phone or the fax, as changes, updates cannot be made through the portal at this time. If a new request is for a service that's not on the previous auth, this will not result in a duplicate. And if a provider wants all the services on one PA, they should be submitted together or call and fax the update. Is there a current, next slide. Is there a current way to do a modification? The best practice for current modifications is to phone or fax your modification need. Make it clear what's being requested. Example, requesting 2 additional visits, add your PA number, and that will get you to where you need to go. In the new future, the portal will be updated to allow providers to modify their requests. Resources that we have listed is the learning management system. We have the Kentucky website, the fee schedule, the home health manual, and the regulations that apply. And thank you. I just want to thank you so much for having us today.
And our little slideshow was really to target those questions, and we really appreciate the time to join your meeting and present this information.
Thank you. It was helpful. Is it possible to get those slides? Will those be sent out?
Yes, ma'am. I'll send them out after the meeting, and they'll also be posted on the TAC website.
Okay. Thank you.
Great.
And
Thank
now
you.
I will attempt to unshare.
Is there a timeline on when the portal will be updated?
We are working hard on it now, but we don't have a specific timeline we can share. Oh, how do I unshare?
I think you have.
Oh, I
Is that
have.
back?
Excellent. Thank you.
Thank you. All right, that's all of them that were listed, but by chance is Stewart on from WellCare?
No, Annalyn Stewart is off today. However, this is Erin Allen, and I
Hey.
am speaking.
Hey, how are you?
I'm good. How are you?
Good. Is he still looking into the incontinence supplies requiring prior auth?
Yes, he is.
Okay.
And he will have to send out an update as soon as he gets that. He can send an email.
Okay.
Okay.
Wanted to check. Thank you.
You're welcome.
All right, I think that's all the new business. I'll turn it back over to you, Evan.
Okay. Yeah, we'll just dive into the general discussion updates from the MCOs.
No updates for Anthem at this time.
All right, I'm gonna start calling on people. Etna, Humana,
No updates at this time.
Passport,
We're all good here.
United,
Hi, it's Suzanne from United. Nothing from us.
WellCare,
We don't have anything either.
and Etna. Just again, make sure I didn't miss you. Okay. Did I call everybody? I think I did.
Yeah, I think you got him. Thanks for your help, Aaron. We'll jump down to updates from DMS and/or Commissioner Lee.
Are there any DMS updates anyone needs to share or would like to share?
I have the wait list information if we are ready to go back.
Okay, perfect.
So we'll start with for state fiscal year 2025. We are releasing for HEB, we received 250 slots. We're releasing 100 to 125 a week for those. For Michelle P, we received for state fiscal year 25, 250, releasing like 85, 85, 80. And then for SEL, we received for state fiscal year 250. And we're also, releasing those as those urgent ones come up. And then also, we have, been working to ensure that the provider network can sustain those slots that we are releasing. Also, for our current information that was for our slots that we are releasing. Let's see here. For our wait list, I am going to provide that. And I'm assuming Leslie still was not able to join.
I have not seen her join, April. I can try to ping her.
May I ask a question, please? This is Teresa with Passport Molina.
Go ahead.
Okay. I apologize, but I'm not familiar with the discussion on the slots. Are we talking about how many waiver slots are open? I'm not clear on the topic of that discussion. I'm fairly new to this group.
Yes, those are the 1915C waiver slots.
Okay, thank you.
Did that cover everything, April?
Yes, I'm so sorry. My computer has locked up on me. I was going to go back and give the wait list, but my MWMA has closed out on me.
Well, that's okay. If you can just follow up, and with an email and give us that info, that'd be helpful.
Yes, I will get that to Aaron and we will get that sent back out.
Okay, perfect. And then, Anlin, did you want to do the last couple, or you want me to just finish up here?
Either way, you can finish up.
Okay. Yeah, I mean, we don't have any recommendations, so, and Susan will be our representative at the MAC meeting, and then I attend as well to do the update from the home health TAC, and our next meeting is October 8th. That says 2025, but I think we're still 2024.
Sometimes I think y'all put that in there to see if I'm paying attention.
A little test there at the end. So unless there's anything else, we'll look for those handouts from Gainwell and just a little bit further detail from TMS on the wait lists, and we'll go from there.
I just want to thank Gainwell and Aaron for working on that authorization issue for me.
Yeah, thanks for getting that information together. We appreciate it.
That was all Gainwell. I just passed it along.
But thanks for passing it along.
Well, you're very welcome anytime.
All right. Unless there's anything else, I'll make a motion to adjourn.
I'll second.
All those in favor, say aye.
Aye.
We will adjourn. Thank you. Thank you, everyone.
Thanks, everybody.
Thanks, everyone.
Thank you.
Have a good weekend and holiday.
Have a great holiday weekend.
You too.